Well, good morning, everybody. My name is Terry Lake. I'm the CEO of the BC Care Providers Association. And before we start this morning, I'd like to acknowledge that many of our staff are hosting the meeting on the traditional lands of the Coast Salish First Peoples. I am sitting in Kamloops on the traditional land of the Shkwapim and the Tecumloops people here in Kamloops, and we appreciate the opportunity to hold this dialogue on these lands today. I'd like to welcome all of our viewers to this important virtual Care to Chat video. It's entitled COVID-19 and Seniors Care in BC, Navigating the Next Wave. Let's start off with some Zoom housekeeping items to optimize your experience today as we're all getting used to this new world. Please keep your cameras and microphones off until we go into the breakout rooms. Use the speaker view rather than the gallery view, and you can select this at the top right-hand side of your screen. We'll begin today's Care to Chat with our panel discussion, and then we'll split into breakout rooms to continue the conversation in smaller groups. I'd like to thank our sponsors for today's event, including our title sponsor, Rexall Health Solutions, our gold sponsor, Point Click Care, as well as our silver sponsors, Sobeys National Pharmacy and the Medical Pharmacies Group. To date, most jurisdictions around the world, of course, including British Columbia, have been affected in some way by the COVID-19 pandemic. Along with workers in general, particularly hard hit has been the senior sector, including those living in long-term care, where many are already frail and suffering from multiple chronic conditions. To protect vulnerable populations, jurisdictions, including BC, have taken various approaches to prevent and reduce the spread of COVID-19, such as the use of personal protective equipment or PPE, implementing infection prevention and control procedures, and by limiting those who can visit or even work at seniors' homes. Despite these actions, the long-term care sector in Canada has been particularly hard hit, accounting for the majority of COVID-19 related fatalities. In late June, the Canadian Institute for Health Information reported long-term care residents made up 80% of all reported COVID-19 fatalities in Canada. That's in contrast to an average of 42% among other countries studied. These findings were reiterated in an October 2020 report by the Public Health Agency of Canada, noting that Canada had one of the highest fatality rates among long-term care residents out of the 37 countries in the OECD. While British Columbia has fared better than other provinces in terms of the number and percentage of deaths that have been happening in long-term care at about 60%, the effects of COVID-19 have still been devastating to seniors and their families, and of course, to providers. In response to COVID-19, there have been numerous actions and steps taken provincially to protect seniors, although some have questioned whether these actions, along with efforts to test residents and staff for COVID-19, were applied quickly or comprehensively enough. While in BC, there was a decline in COVID-19 long-term care outbreaks approaching close to zero in the summer, we've seen increases over time, particularly as community transmission increases. And of course, that is the main contributing factor in outbreaks in long-term care. As of mid-October, BC had 17 long-term care and assisted living sites with COVID-19 outbreaks, while the number in Ontario had quadrupled over the past month, and other provinces such as Quebec, Manitoba, and Alberta were also dealing with outbreaks coinciding with overall increases in the community. Less than a month later, the number of outbreaks in long-term care and assisted living in BC has doubled to over 40. And as cases continue to increase and jurisdictions enter the second or even the third wave of the pandemic, BC Care Providers Association believed it was important to better prepare for those second and third waves. Therefore, in late July, the BC CPA's Advisory Committee on COVID-19 issued initial draft recommendations to better prepare government and the sector. In total, 17 initial recommendations were issued under 4 key areas or themes, including pandemic preparedness and coordination, reducing infection transmission, supporting staff and operators, and providing social supports. BC CPA thought it was also important to engage with care providers and other stakeholders to discuss these recommendations further, and also to identify any further areas or gaps that were not initially outlined in the recommendations. So this engagement process was led by the How Group and included stakeholder consultations, a comprehensive survey, as well as a literature review. And based on that engagement process and that review, BC CPA has released its final report with 24 recommendations, which, as you are aware, will be the focus of today's Care to Chat. And as part of our panel discussion, we'll follow that with breakout sessions, which will start around 11 a.m. With that, I'm pleased to introduce a video from Rexall Health Solutions, to be followed by Scott Patterson, Customer Care Manager, Rexall Health Solutions, who will introduce our panelists. And I just want to say that Scott's continuing care experience started in 2008, where he gained his nursing license in Vancouver. Scott was immediately hired by Vancouver Coastal Health at Lionsgate Hospital, and he worked with the float pool team within Lionsgate with experience in general med and surgery and first aid and emergency and a number of other departments in the hospital. In 2015, Scott, with his family, moved to Calgary, where he was the Director of Health and Wellness for private supportive living facilities until 2020. And most recently, Scott was the project lead for a year-long accreditation to bring the Butterfly model of care to support those living with dementia. In November of this year, Scott has joined Rexall Health Solutions as the Customer Care Manager for Alberta and Eastern BC. So with that, we'll go to the Rexall video.
Filling prescriptions. Simply being part of our communities. From Ontario to BC and everywhere in between. We've been on this journey for over 100 years, taking care of your residents, one person at a time. And while the care you've been providing has taken on many forms over the years, the actions we're taking today are just another example of how committed we are to you and your residents. So we want to thank you for slowing down, for giving yourself space, by changing the way we deliver care, for keeping a safe distance. We're making these changes because we care about you, our employees, our communities, because they depend on your support, and you can depend on ours. Take care and be well.
Thank you, Terry. I'd also like to welcome everyone here today on behalf of Rexall Health Solutions. This is a very timely and important discussion, particularly as COVID-19 cases continue to escalate in the community as well as in seniors' care. As we enter the next wave, this Care to Chat will focus on some of the key findings from the engagement process and the recommendations outlined in the final report released last week by the BC Care Providers Association. In particular, building off these findings and discussions at the BC Care Providers virtual conference in September, this Care to Chat will also highlight how we can better prepare and mitigate the effects of COVID-19 in seniors' care and living in the 4 areas of themes outlined, such as developing appropriate plans and communication processes, reducing transmission through the use of personal protective equipment, testing and infection prevention and control measures, addressing staffing and training issues, and providing social supports, including improving quality and ensuring safer family visits. I'm very pleased to introduce today's panel consisting of experts, including providers from BC Care Providers, COVID-19 Advisory Committee, as well as academia who also assisted with the review. First, I would like to introduce Dr. Denise Cloutier, who's a professor at the University of Victoria in the Department of Geography and a research affiliate with the Institute of Aging and Lifelong Health at the University of Victoria since 2001. Dr. Cloutier was also one of our expert academic reviewers of the final paper. Next, I would like to introduce Winona Gianassi from the How Group, who is an evaluator and strategist specializing in the public sector, along with over 15 years of experience leading evaluations, engaging stakeholders, and supporting organizational development initiatives. Winona, with her colleague Jennifer Heistad, led the development of the final paper, including survey and stakeholder consultation work. Finally, I'd like to introduce Deborah Houtman, CEO of Langley Lodge and a member of the BCCPA board. Deborah was also a member of the BCCPA COVID-19 Advisory Committee that assisted with the report, along with several staff and board members, including Ellie Devji and Dave Herford.
Thank you, Scott. Really appreciate the support of Rexall Solutions for our Care to Chat this morning. So I'd like to ask each of our panelists to just give their opening remarks, and let's start with Dr. Cloutier.
Sure. Thank you very much, Terry, and thank you, Scott, for that kind introduction. Can you hear me well? Okay, thank you. I want to begin by just expressing that I am on the Lekwungen speaking peoples territory, the Songhees, Esquimalt, and Wasanich First Nations, and that I'm very grateful to be here with you all today. I also wanted to just briefly express my profound gratitude to the BC Care Providers Association and the Howe Group for this critical and timely report. I think the information that it gives to us about the pathway that COVID has wrought so far and ideas and recommendations for going forward will be meaningful for British Columbia and also for other jurisdictions in Canada and beyond. And so I want to commend them on that report. I want to thank the essential workers, and I also mean leaders right on through to direct care, care team members on the front lines. I think everybody involved in this environment is so important and critical at this time, more than we ever thought, and their roles in providing high quality care under some extreme conditions are to be commended again as well. The last thing I want to say in these opening remarks is that I am in many ways an outsider to this system of care as an academic. And so I kind of am coming with this critical viewpoint of how things work and don't work. And that's partly because that's my training. But again, coming with deep respect for the work that is underway in this community. And I wanted to emphasize that some of my comments may feel a bit biased today because a lot of my work, or majority of my work in the last 15 years, has been in long-term care and home care, and more recently in relation to integrated palliative approaches. So you may see that some of my comments are shaped in that direction. So thank you, and I look forward to this whole meeting today with you.
Thanks, Dr. Cloutier. Winona, would you like to provide some opening remarks?
Yes, absolutely. Hi, everybody. Thank you so much for having us here today. I'm really thrilled to be able to discuss this engagement report on behalf of Jennifer Heistad and myself. I guess I wanted to reiterate really what the objectives of the report were. So I know we're going to be, having an opportunity to discuss, I think, the findings and the impacts going forward. So the objectives, of course, were to identify facilitating factors and challenges in response to COVID-19 in the seniors care and living sector in BC. That was the first one. I really want to highlight the second one, and that was to convey the voice of care providers. So it was really to convey the voice of care providers membership. And I think building on what Denise just said, the dedication, that word isn't strong enough to thank the leaders and the staff. What we have seen, we've had the pleasure of working with many of the care providers members over the past few years, but just the level of care and just absolute dedication that we've seen is quite something. So our work started early in the spring. It's building up to our comprehensive engagement. So BC Care Providers really led this work from the start and adopted what was called a Team BC approach. So working with government stakeholders. And so government has been engaged in dialogue since the very, very beginning of all of this. As Terry mentioned, we took very much a mixed methods approach to this engagement. So had the opportunity to conduct surveys, some in-depth interviews. I see many familiar names up here. So thank you to all of you that we had the opportunity to speak with and learn about your journey. some roundtables, and an online submission where members had the opportunity to provide some initial input into the recommendations. So the recommendations that we have developed in this report have been grounded solely by care providers and researchers. So the recommendations that you see are very much evidence-based from the sector. Some of the findings that we really had talked about, so of course, was around actions that flattened the curve and factors that we felt contributed to the transmission. Of course, health, human resources definitely came up as a very systemic issue. PPE, communication, visitation, moving seniors were some of those, fairly big issues that came up. The impact among providers, and an issue very near and dear, I think, to all of us is absolutely the senior and worker rights. So those are some of the sort of main categories. I also would like to acknowledge our advisory committee that worked very tirelessly to ensure that this engagement had clear objectives and set us down the right path. So thank you to the board members and leaders, also to care provider staff who always provide such great direction and support through all of these kinds of processes, and to our academic reviewers. We didn't know what we were getting into when we had an amazing panel of reviewers. And Denise, thank you so much for being here as one of them. Without a doubt, the report is better off because of that process. So thank you so much. Thanks,
Winona, and someone who was at the leading edge, or right at the front lines of the fight about on COVID, Deborah Helpman from Langley Lodge. Deborah. And I think you're still muted there, Deborah.
Good morning, everyone. Sorry about that. Oh, it's a delight to be here today amongst all of my colleagues. I see all your names up there and photos. It's good to be part of this discussion. I'd like to thank BC Care Providers and the Howe Group for producing this timely report and under fairly tight timelines to conduct such an extensive survey, and to all my colleagues who decided to participate in the surveys and the interviews and the data gathering, because I believe that together our voices are very important and influential in terms of how decision makers will determine the next steps for pandemic management, since we're going to be in this for a while. I represent the board of directors, and I was on the advisory committee, but I'm an operator. I'm the CEO at Langley Care Society. I'm a registered psychiatric nurse by profession. I've worked in long-term care for a good part of my career. We operate a 139-bed long-term care home in Langley, and we experienced a significant outbreak in May and June. And, the question we all had is, how could this happen in Langley Lodge? We're accredited, we're licensed, we've upgraded in our facility, we have single rooms, we, have an adequate complement of staff, and we're able to retain staff. How could this happen to our home, and what can we learn from it? And we really felt, or I personally really felt, a duty to share our experience and inform my colleagues and anyone else who wanted to listen about what we need to do to mitigate this for the second wave. And I have to say that my heart is breaking today for the number of care homes that are in outbreak. And I feel somewhat traumatized by this, because I had hoped that we could somewhat avert this. So, my participation today is really to just add that practical perspective from the ground level, and how those recommendations are really real and valid for us as operators. Thank you for inviting me.
Thank you, Deborah. And from all of us, thank you for your report, which was, shared with the government and the seniors advocate, and that transparency, that willingness to for others to learn from what you went through was very important. I'd like to start the questions with Denise and Winona. And just from your perspective, were there any surprises that jumped out of you from the engagement report?
You're starting with me.
Yes.
I have lots of notes that I know I won't get through today, but compulsive note taker. Were there any surprises? I kind of wish there were more surprises. And I guess what I mean by that in one way is that it feels to me that some of the pressure points that were highlighted by COVID, we've known about for many years. A lack of funding in the sector, chronic human resource shortages, frontline workers who feel they kind of are walking in a storm many days, trying to do the best they can with not enough time to do work in the way that they want to. And so, yeah, it's no surprise that COVID has again amplified and highlighted some of these stresses and pressure points that have been around for a while. But I guess in terms of the question of surprise or shock, I feel kind of like one of the things that hit me that was in the report was the idea of the focus was not on the virus, was on the virus and not on the people sometimes in the sector. And so I think one of the points I would like to emphasize today is to encourage us to be thinking of that. How do we work in more person, client, resident-centered ways than system-centered ways, trying to think about those pressure points in the systems, because I think sometimes the solutions that we'll bring to bear will look slightly different if we're focused on individuals and families. In addition, we kind of have to balance both of them. What can the system do? But what are the residents' needs? And sometimes those voices are not loud enough in the system. So maybe I'll just stop there for this question.
Thanks, Denise. Winona?
Thanks, Denise. I think that's kind of a nice segue for me. I also have many notes, but the first one I think that I would just say is honestly, it's the raw sadness and just the impact on the seniors, on their families, and on the providers. Some of the interviews that we conducted, it was really, really hard not to just let the tears roll. So just the absolute raw emotion that has been felt from all of us, I think was really highlighted. So I will try not to tear up as I say this quote. And it was so highlighted to us. One of the providers said seniors ate alone in their rooms for 60 days. And that just kills me. That's so terrible. So I think it just has highlighted so much the need to support providers as they support seniors and families. I think that's just one of the key things that really came up for us. I'll jump to something a little less emotional. The integral role that communication needed to play and should have played had it been managed properly. We heard providers say that they were ensuring their staff were actually, there was a staff appointed to watch the 3 o'clock news so they knew what was happening. Providers were learning at the same time as the public was, and that was creating so much stress. It was mayhem. It was absolutely mayhem. I mean, we all know these are really challenging times. This is crazy. Even the best laid plans are really hard, but I think that the communication could have been handled so much better. The lack of consistency in communication between health authorities, I think that was really magnified for us during this process in the providers that we spoke to. So much so that 80% of providers said that there was a lack of clarity around which body had authority as directions were given or changed. That was a pretty big takeaway for us. I think, just sort of building a little bit on kind of the systems piece, I think something that we found really interesting is that the impact that the solutions actually had on the sector. So from single site to the wage leveling, the pandemic pay, these were all intended to be solutions, but certainly provided a great deal of angst. We heard quotes such as, the wage leveling and single site order was an accelerant to health human resource issue. I think maybe I will just leave it by saying, and Denise, I think you also said, you really mentioned around what this highlighted for us in terms of, the systemic issues, is that the impact that the Health Human Resources have played, certainly in terms of adequately staffing in an already very, very thin sector. I hope that that is one of the key takeaways. We've all been talking about this for so long, and there's so much hope that things move forward in this area, but I hope that this is one of the biggest takeaways. One of the providers said, there is now a spotlight on long-term care and seniors. This is our opportunity to embrace some of the systemic issues we've been struggling with for years. Maybe that's the silver lining, that it's emphasized the need for health human resources. I'll end it there. Thank you.
Thanks, Winona. Well said. Across the world, we saw a real emphasis at the beginning of the pandemic on acute care. I mean, we saw, the hospitals being built in Wuhan. We saw the emergency rooms and the ICUs in Spain under so much pressure. Winona, what did operators tell you about the way the government handled the initial effect of the COVID pandemic, acute vis-a-vis long-term care?
Yeah, thank you. We found from providers straight off the bat that there was just not enough information actually known about the long-term care sector. 80% of providers felt that the PHO actually did not really know the sector. Providers felt very much that there was a missed opportunity for associations such as care providers, obviously, and others to engage the sector properly in meaningful discussions. Home health and independent living were really never truly included in any communications and orders or recognized for their service. Long-term care providers very much felt like an afterthought, as they were not originally included in discussions around PPE planning and communication. We feel from the discussion with providers that had there been recognition of long-term care and not the sole focus on acute from the start, that some of the detrimental impacts in terms of quality of life and the heartbreak with respect to visitation could have been better handled. And potentially, I think I should stress potentially, some of the deadly outcomes may very well could have been reduced with adequate PPE from the start. I think our takeaway is that it's essential that the entire continuum be integrated, and that system-wide coordination, as always, is really needed. It should not be seen as quite so distinct.
Thanks, Winona. And Deborah, from your point of view, first of all, did you ever imagine that long-term care would be so impacted? And how did you feel about the government's initial response in terms of focus and inclusion of long-term care and seniors care generally in the response, and speak to the challenge around personal protective equipment as well, please?
Oh, sure. No, never in our wildest imagination did we think that we would be impacted in, the way that we were, in the scope and the scale of COVID in long-term care, the impact on our operations overall, every aspect of everything that we do. And nor did we ever think about the outcome and how tragic it would be. And, speaking from an operator perspective, we felt left out and forgotten and ignored in some cases. And I had to really, beat down a path to get the kind of resources that we needed, to help us get through our outbreak. And at the beginning, this was very early on. Our outbreak started in late April. There was no PPE available to operators. We were told to, search through our own suppliers, and there were worldwide shortages, and our suppliers were trying their best to, find every manufacturer that they could to get us the minimum. And then when they got stuff, they were trying to share it amongst all of their customers. And so we were getting things in dribs and drabs, and we were buying things from, places that you wouldn't imagine, like breweries. We were getting our hand sanitizer in whiskey bottles. and it smelled like whiskey, which was actually a good thing at that time for all of us. And hardware stores for goggles. We were going to Canadian Tire for PPE carts, and the quality of gowns were absolutely crappy, pardon the language, but they were like gauze, and that was all that we could get. And it was a contributing factor in our spread of the virus, because we were not protecting our staff adequately with the quality of stuff. So it isn't that just the amount of supplies, it was also the right supplies that were missing for us.
Thanks, Deborah. Let's turn to the single site order. We know that the virus makes its way into long-term care mostly through staff. We haven't seen visitors bringing the virus in. And so the single site order has been credited with reducing the introduction of the virus. But Denise, is the single site order here to stay? Is it practical? And what are your comments about the impact that the single site order had on the pandemic mitigation efforts?
Mm-hmm. Thank you, Terry. This is a really important question and area, and sometimes I think this morning we'll be duplicating what each other are saying. But I guess this is a question that I would like to pull back a little bit and say there is a societal problem with undervaluing this workforce. And I think that's where many of these issues begin. The work that's being done by people in long-term care, people in childcare, people looking after individuals who are homeless. We have not recognized the importance of this work. And as a result, we haven't created opportunities for fair wages and fulsome benefits. And I think that is where things have really gone awry for a lot of years. And if we could address some of these wage inequities and disparities, we will have a workforce. I think that actually would have a lot of long-term gain for the system and the care of vulnerable populations. Yeah.
Thanks for that. Deborah, what are your thoughts? What is the impact of single site order in terms of managing the workforce in long-term care?
The impact for us has been a loss of all of our relief staff. And we still very much support single site staffing. We believe that's going to have to be the way it goes for the long term. But I think we could modify now because we know more than we did in March. And we need to look at the fact that we do need part-time workers and casual workers. And there are people that want to do that work, that want to balance with other obligations in their life, or it's a lifestyle choice. I think that we can do that work and make this a bit more effective for us. And I totally echo Denise's comments about wages, and would like to just mention that with wage leveling, the feedback we're getting from staff is they want more hours now that they're being paid well.
Well, that's certainly a good thing. And we always echo Dr. Samir Sinha's comment that Canada spends about 30% less on seniors care than peer countries in the OECD. So as Denise said, this is maybe an opportunity to fix many of the problems in the system. So we can't let that, the virus and the pandemic and all the troubles not go without a solution permanently to those kinds of issues. Winona, part of the problem that we saw with independent living and home care was being left out of communications, being left out of the temporary pandemic pay, for instance. Can you talk about what operators of independent living and home health were telling you? And then maybe we'll go to Denise for your comments on the private versus public sector. Should there be a difference in the way government approaches them in a pandemic?
Yeah, thank you. So we had the opportunity to, of course, to speak with independent and home health operators. We conducted a couple of roundtables, and as we were working our way through some of the draft recommendations, the key takeaway every time was, please include us. Our voice is missing. So we feel really strongly from speaking with providers that regardless of the operating model, providers are employing and they are providing service to British Columbians. Staff need to be safe in whatever model they are employed. They're caring for our seniors, and Denise, as you said, so much of what we're all saying is really aligning with each other. Staff need to be valued for their work. Those were some really big key takeaways for us from the providers. I think the distinction that was created added a layer of complexity and confusion that just was not needed. It impacted workers, leaders, families, and seniors. I'll say, the numerous engagements that we've had with care providers over the years, we continue to see so many ways where public and private providers are very willing to work together and do work together, collaborating and sharing best practices. So, I think our thought is that this needs to be recognized definitely from government. A couple of providers we spoke to said, hey, we really only learned about what was going on because we also happen to operate long-term care in another part of the province or in another part of the country. And so it was only through this we were learning and hearing from each other. Or it's because I sit on this committee, I heard from this colleague over here. And it was very much in that informal way. Otherwise, independent and home health were really left out to dry, unfortunately. That's our kind of key takeaway from the engagement.
Denise, what are your thoughts?
Yeah, I think this draws back to what Winona was saying earlier, reminds us about the fragmented nature of our system. It's not really a continuum. We've known that for a lot of years too. It doesn't operate as a continuum. It's not integrated in the way that it should be to provide the best care for individuals. We can draw back to the Canada Health Act, which really has never caught up with the fact that so many more services are required to keep us healthy and well. And the Canada Health Act doesn't recognize long-term care, continuing care as something that needs to be supported and fostered at the federal level and provincially. So that's an important part of understanding that we need to value all of the partners who are providing care. Every organization plays a role, and there's so much diversity in the system, and we have to try to capitalize on that as well. Again, in the context of helping individuals with quality of life, dignity, and respect throughout the lifespan. So yeah, I definitely feel there's a role for expanding and appreciating the continuum of providers. Yeah, sorry, Terry.
Thanks, Denise. Well, and you mentioned quality of life, and one of the heartbreaking realities of what we've been through in continuing care is the deterioration of quality of life, separating families from their loved ones. Of course, with the best intentions in mind, but as pointed out in the Seniors Advocate report, many people in long-term care have said, I'd rather be visiting with my family and take that risk than live the life they're living. So maybe Deborah, starting with you and then going to Denise, just talk about the quality of life issues that maybe have not been addressed the way they should be.
Around visitation, Terry?
Yes.
Yeah, it's been really difficult for families and for residents. There are family members that before COVID came in every day, particularly spouses and in some cases, like a daughter who was providing care in the home before the elder came into long-term care. And it's a real struggle to find this balance between allowing and encouraging that time to continue, that face-to-face time, that tangible in-your-face time, to the safety needs of the resident. And a lot of residents, at the stage of their life that they're in, they feel that this is a risk they would like to take because they're feeling so detached from their families. I do agree with, the Seniors Advocates report that it could be looked at a little differently. I think, again, we're in a better position now with knowledge learned. I think the public is more educated about, infection control and prevention and wearing masks, and that certainly family members are, because they're coming in for, controlled visits, and that, we should be able to adjust this. I don't have the exact answer, but I think that it is something we have to work on. It's really critical for the mental well-being of the residents and for the families.
Denise, what are your thoughts?
Yeah, I really support what Deborah is saying. In the overall look of the report, I think the importance of family supports is kind of right up there as a second or third priority. We don't want the second wave to look like the first in terms of the exclusionary way that families were treated. I mean, they're resources to the system because they help offset some of the stress and strain that are faced by the frontline workers, in addition to just the terrific distress and hardship that they undergo when they can't see their family members. So I think in this next wave, are there technologies that we can mobilize more effectively to bring families together, not to have somebody on the third floor be told they can't, or family member can't wish their 100-year-old mother her happy birthday because she's on the third floor and they can't manage to make those technologies kind of happen, or that close to face-to-face contact happen. So that's a real problem. And I think it kind of ties to the testing questions, right? In terms of if we can improve and enhance testing and understand the protocols better for PPE and just transmission possibilities, all of these things, can we allow families to be closer to their loved ones at the times they need to be then? So will improvements in testing allow those relationships to continue to develop? I just feel that this is a very critical area, and the impacts of social isolation long-term are so huge on individuals and families, and they increase the difficulties faced by the direct care workers as well, who are then acting as pseudo family members in addition to their already very challenging roles.
Well, speaking of technologies, and you touched on the testing question, other sectors, whether it was the film industry, sports leagues, figured out how to manage that technology and create a safer environment for their sectors to continue. And unfortunately, the second wave is looking very much like the first wave in terms of separating families. Deborah, if we had started using rapid antigen tests, for instance, like the film industry, like sports leagues, back in the early fall, would we be able to reunite families a little better now?
Yeah, I think we could definitely use that as one more step on top of what we're doing. I think it's important to say that it wouldn't take the place of all of the measures that we are doing, but that would be one more step. And there's real advantages for the workforce because we have a lot of downtime between somebody having symptoms and being tested, and and being isolated while we wait for results for a test. There's many reasons why this would be really helpful for us. The rapid testing does not require symptoms. And we know that with our public system right now, they will only test people with symptoms. We'd like to be able to get to this before there's symptoms. And we know that people can shed virus several days before they have symptoms. I'd just like to say that I wasn't aware that there is a private testing system and a public testing system. And we haven't even thought about exploring the private testing system. And it's available and there is a cost to it. And so I think we should be considering both options.
Yeah, it's a good point. Life Labs, for instance, will do that testing. A number of other companies. Ideally, we would be doing that in conjunction with the ministry or health authorities, so we could, do it as part of a research project and learn how to best use those tests in conjunction with the PCR test, for example. Winona, let's move on to the subject of dedicated COVID units for those testing positive. There was quite a split in operators' opinions whether or not to take COVID positive patients and move them into a specialized facility. Can you talk about that split from the operators?
Yeah, absolutely. I would say this is the one area in the consultation where it actually was the most split. In most of the areas, there was kind of a clear direction. So providers definitely did have mixed feelings about moving COVID positive seniors. I think in part it was influenced by the ability of the site to effectively isolate seniors. And the capacity of the residents that they were living in to meet seniors' needs. About 3/4 of the survey respondents did agree with moving seniors to a specialized unit, agreed that moving positive seniors would have helped to limit the transmission. For the most part, sites just simply are not built with appropriate areas for isolating seniors. I think we found that is particularly of concern, especially when caring for residents living with dementia. That was definitely a big area that we heard providers certainly comment about. There was, a couple of providers said, absolutely, there is no way the resident should be moved. This is their home. They're in their end of life. This is their home. This is what they know. Why would we move them, and why would we make it harder for them? So I think this was definitely recognized as, certainly the ethical challenges and the ethical discussions that come into play with this, in addition to, to just the infection control side of things. So I think there really was a balanced perspective of allowing seniors to remain where they're comfortable or moving them sort of for the greater good. I think that the key takeaway for us is that providers that had capacity to isolate seniors were fine with them staying where they were. Those without capacity felt that there was a desperate need to support residents. There was comments around the fact that seniors, quite frankly, would be cared for better in an acute setting with access to specialists and equipment. So I don't think there's a clear-cut answer on this one. I feel like having the options there, so providers have options to move seniors when it's necessary. I feel like that's probably the best thing that we could look for. And the flexibility, I think, to honor what's right for seniors and their families as well.
Thanks, Winona. Denise, you mentioned the Canada Health Act, and it does not include long-term care. The federal government has indicated through the throne speech that they're interested in developing national standards. What role do you think the federal government should have in seniors' care, or does it fall squarely as a provincial health responsibility?
That's a tricky question. I do personally believe that the federal government does have to play a role, does have to support resourcing to the healthcare sector in a bigger way. In the 1970s and 80s, when we had transfer payments for health, we lost that. That caused a lot of problems for provincial jurisdictions. So I think we do need the federal government to be more involved, more concerned with a healthcare system that is more integrated and holistic. I think, though, provinces want to retain responsibility, and that's fair and important. We have so much diversity within the system again. So I would go back to, that kind of controversy or challenge when we're thinking about standards, and at the same time, we also need flexibility. We hear the word, we need to be nimble, we need to be responsive, we need to work with our teams and the dynamic conditions that exist within every organization and facility. at the same time as we're saying we need a pandemic plan that has clear guidelines and more consistent messaging and more timely information flow. So these tensions are really difficult to try to think about resolving. But I think that's where the challenge lays going forwards for us. It's sufficient federal and provincial commitment. It's plans that are clear and transparent, but have flexibility, because I think we're also at a point where we need the blue sky thinking. We need organizations and facilities to work with their teams to the best of their ability in different ways. So I realize that sounds like a kind of it's just a difficult thing to resolve. How do we make both of those things happen at the same time?
Yeah, it's always very difficult to get provinces and the federal government to agree, particularly around healthcare. I know from experience, it's always a very controversial topic. And another controversial topic is, Deborah, the regulation involved in long-term care. We see that operators are inundated with paperwork, and no one, I don't think, minds transparency. And there's calls for more regulation, particularly, in talking about private for-profit care. What are your thoughts on how governments should regulate? Should we be looking at checklists, for instance, or should we be looking at quality outcomes and designing regulation to have quality objectives at the end of it?
Well, I think we do have quality outcomes with accreditation. And so I think that is met. And I can tell you about the volumes of checklists that we are all now dealing with. And we certainly did through our outbreak, but now are kind of in place as an ongoing measure. In the regulatory framework, though, I don't know that we need more regulation. I think maybe we need to look at maybe we need to massage the regulation a bit, because there's sections in the regulations about staff qualifications, and we don't have dedicated infection prevention and control specialists in long-term care at all. That's a discipline that's completely absent from the radar. And so in terms of our obligation to have the right staff qualifications, I think that is important. And then, the staffing mix in terms of regulated care, because as we know, with acuity levels being much higher, we need more regulated staff. We just can't find them. So I think, the regulations, need to just be reviewed. I think that we have enough requirements to, with licensing and with inspections and with now all of the audits that we're doing, and with our accreditation standards, that I think that the sector is well served in those ways.
Thanks, Deborah. Winona, can you just talk a little bit about how were providers feeling? How are they dealing? We all worry about the physical and mental health of those on the front lines of the pandemic. Can you just talk about how the pandemic has affected people working in continuing care?
They're stressed. They're stretched. I think they're exhausted. They won't give up. There's just commitment to keep going forward, but they are absolutely exhausted. One quote that will always remain with me, this person said, "I have raised newborn babies. I've cared for parents with cancer, and that was nothing compared to this." So providers they're absolutely at their limit. They need that support. But as I said, there is an absolute commitment to keep going forward. The people in these roles they're incredible. They show up every day. They are really the heart of our system. So they're keeping on going. And I think, thank you very much.
Well, we're nearing the end of our panel discussion, but I'd like to invite each of you just some final thoughts before we go into the breakout sessions. Denise, why don't we start with you?
Sure. I would just like to, in my final comments, I guess, support again the needs of the workforce and doing whatever we can to enable essential workers to continue to do the work that they do. And again, we know that we have this major human resource shortage. I would reiterate once more the importance of proper wages and benefits, and thinking about how are we going to draw more people to these jobs if we don't do that. We need to inspire others to come into this field to do the work, and we need to give them training on an ongoing basis. It's not just one time. The rules change almost daily with COVID. So I really would like that to be a higher priority going forwards as well. Yeah. Well, thank you.
Winona, your closing comments?
Sure. You know, again, Denise, I mean, we echo that so much about the need for the health human resources, for sure. You know, valuing people that provide this kind of care. I guess the other really big key takeaways for us are certainly around communication. And you know, I agree so much that there's such a balance. We want, you know, we want clarity and we want direction, but yet we also want flexibility. And it's very hard to find that, you know, that right kind of balance that will always shift. But communication is key. And I think the other thing is it's collaboration and definitely integration of all aspects of the continuum. And I think I hope very much that our entire system can be looked at as one system, and very, very much with seniors and staff at the center of it.
Thanks, Winona. Deborah, your thoughts?
Yeah, just a couple of comments about policy again and the impact on us. And, you know, in regard to the population that we serve who have advanced dementia and severe cognitive impairment, who cannot be isolated. This is the you know, a factor that is affecting a lot of homes that have got the higher number of cases. And I think that, you know, we have to look at that policy and determine if that is the right way to provide care for that group of that population, that segment of our population. And it raises the ethical dilemma that we are all in, which is, you know, do we, you know, do what we normally do, which is a palliative approach to care and keep people in the home because it's harder for them to be moved to receive care somewhere else? Or do we move them to receive care somewhere else so that we protect the other residents in the home? And that is a really challenging dilemma that we are all in. And I would just like to reiterate that we need to pursue options. There just has to be some options for operators around that.
Thanks, Deborah. Well, I'd like to thank each of our panelists, Denise, Winona, and Deborah, for your insights into this report. And now we're going to have an opportunity to go into breakout rooms. And so there'll be 3 breakout rooms, and we'll have more of an in-depth conversation there. And then at 11:25, we'll come back to the big room for closing remarks. And be sure to turn your camera on when you enter the breakout room and unmute yourself when you'd like to speak. Who thought we'd ever have to worry about these things like we do today? Anyway, thank you very much, panelists, and we'll see you in the breakout rooms.